Hi, good afternoon, everyone. So today we've got two very interesting individuals to tell us a little bit more about digital health in Southeast Asia. But first, I think I'm going to let the two of you introduce yourselves and the companies you guys have founded, because I wouldn't do justice if I were to explain what you guys do. So in your own words, maybe you could just like introduce yourself and tell us a little bit about your companies.
You first? Okay. DocDoc is Asia's largest doctor discovery company. And really what we do is we're an arms dealer for insurance companies. We focus on consumer empowerment, and we help patients find the right doctor, clinic, and hospital for a particular course of care by leveraging the latest in kind of clinical informatics. We operate in 8 countries. We're 5 years old. Yeah, it's been a really interesting ride in Southeast Asia digital healthcare.
Hey, hi, I'm Nick. HomeGP is about 16 months old. We champion home care in ASEAN. We partner with hospitals to deliver a home care solution, anything from renting a hospital bed to delivering pharmaceuticals to getting nurses, caregivers, and physios to support you. Prior to that, I started Catcha.com, and yeah, the home care space is big. Let's get into it.
Cool. So digital health, really broad sector. So maybe you can tell us a little bit more about your observations in the sector and just major trends you're seeing, especially in Southeast Asia. Nick, you want to start?
Yeah,
maybe?
so maybe I'll start, right? So why did we get into it? What's motivated us to build and start a company like this? So I use a triangle that works for most businesses. Product discovery, product discovery, price discovery, and deliverability. When you have ticks on all 3 elements, you get a transaction. That means I need this, I'm willing to pay this price, and I can get it at this place, or it can come to me at this place by this time. What we found is that the area around the demand for the product was strong, basically based on aging health, aging people, aging population, much more wealthier, of course, much more, they have a view on how they want to be treated, etc. They will have a view on what kind of technology and access to medical equipment, etc. that they want. That's that. The second thing is price has become important. People are not just price takers. You don't just go somewhere and just say, whatever you charge me is what I'm willing to take. No. With marketplaces, with price discovery and comparison, people care about what they're paying for anything or most things that are above a certain ticket item and price. And the third thing is that the delivery mechanism was broken. There was no way to triangulate all these 3 things. So we came in with a solution, we think, which builds on all 3 legs of the triangle.
Yeah, so I think one of the hardest things about being an entrepreneur is, and anybody who's ever heard me speak about entrepreneurship, I'm always talking about the hard things, because it just feels like there's just so many difficult things in starting a company. And I think one of the hardest things is you need to start before anybody's talking about it if you want to be on time when everybody's talking about it. So, we started years ago in doctor discovery, and the reason that we picked that space and the reason we thought Southeast Asia in particular would be a very interesting hub for digital health, and I think the market's actually ripening beautifully, is because it's insane the way we globally consume healthcare. It just doesn't make any sense. When you need to find a doctor, you literally call your friend or your brother or your brother's sister's cousin, and someone says, oh yeah, I know a doctor, he's a good doctor, his name is X. And then you end up going to that doctor and just trusting them that they take care of you. Well, when you start digging into the data, it's very clear they don't take care of you. We're just starting now to see a lot of aggregation, information technologies enabling aggregation of large chunks of information. And what we're finding as it applies to healthcare is really frightening. So as an example, in the United States, the third leading cause of death is actually doctors making mistakes. Number 1 is heart disease, number 2 is cancer, number 3 is doctors' mistakes. The Mayo Clinic has shown that even among doctors in their hospital, and if you're a doctor in the Mayo Clinic, you're one of the best in the world, that even among those doctors, when you go to a doctor that subspecializes, let's say an orthopedic surgeon, that subspecializes in knee operations and versus an orthopedic surgeon that subspecializes in hip operations, and you go to that doctor for the thing he's not subspecialized in. So you get a knee surgery done by a guy that subspecializes in hips. Even though he's an orthopedic surgeon, even though that's something that he specializes in, you'll find that his complication rate goes up 500%. And if those details get a little lost in the audience, the point is this: there is a giant difference between which doctor you go to depending on the ailment that you have. And that information is eminently knowable. And as the first wave of the internet crashes into the healthcare industry, you're going to find massive improvements in efficiency, improvements in quality of care, and a real shakeout of a lot of institutions that fundamentally don't add value in that ecosystem. And I think now is kind of the beginnings of that. Medical tourism, and we were just talking about, before the panel began, what are the things that are uniquely changing now? So you look at internet penetration and the way we consume information on smartphones and our overall appetite for information when we make decisions. Look at how much we're willing to travel. All of these things juxtaposed upon the importance of healthcare in our daily lives. This is why now is a good time for digital health.
But the other thing that we are seeing also is that historically people used to assume that their healthcare is dependent on the government and the company and your family, etc. Well, that time is changing. Now, people have to realize that you own your healthcare. You own your health. It is your business to know how you're feeling and how you're doing and what you are like. And that's the other thing that's happening. So there's political awareness and awakening. There's healthcare, personal healthcare awakening, right? I have friends in this room here who have started running half marathons because they realize that they need to get healthier. They've got a beer gut, right? He knows who he is. And as an example, yesterday I was with an old friend of mine who's in the insurance space, and he told me in his 9 years of being in insurance, he has never seen any client claim the available 120 days of home care in most of the medical policies that are sold in Malaysia. It's just ignorance. It's crazy. People don't realize that after you've been discharged, which is what we support, you are actually eligible for 120 days of home care. You just don't know how to get access to it. You're just ignorant.
Wouldn't it be cool if there was a service that would allow that to happen?
Absolutely, call homegp. All I care about is I want every Malaysian or every ASEAN person to share with me their medical insurance policy. If you just take control of your own medical needs and you give me a policy, I'll be your safety net. I will tell you what you can and cannot do and how you should go about it. What's claimable, what's not. So that when you're sitting there post-op, you know who to call.
I think that's a really interesting point. So I guess I agree that consumers are ready for a service like this. I think the difference between this sector and every other sector is that this is one's health we're talking about, right? I mean, if I go to an e-commerce company and buy a T-shirt that I don't like, I just return it. If I go online and find a doctor that gives bad advice, I can't really go back on that, can I? So I think the problem is how do you overcome that trust, especially in Southeast Asia where information is really scattered, and I think a lot of us just end up picking which doctors we want to go for based on recommendations, or like, hey, my friend's uncle said this doctor's like the best in town, so I'm just going to go with that, versus I'm going to go online, go on Google, and figure out the right doctor. So I think trust is a really big issue, and I think it might be the biggest issue you might face in getting more consumer engagement. So how would you address that?
So I think we're in a historic time for digital health, so I don't want to dampen any of that belief. I think it's in a really, really interesting inflection point. That being said, there's many reasons why companies that succeed in digital, that there's only going to be a few winners in the digital health space. It's real hard to execute, and this is just one part of it. So part of the reason it's so hard to execute in healthcare, and we spent about 1.5 years on this one problem. So Indonesia, to a certain extent Malaysia, to a large extent Thailand, to a massive extent China, these are low trust societies. The amount of inherent, well, I'm just going to trust you, you'll take care of me, it's actually quite low. The family nucleus is very strong, and trust among your network is very important. But the problem in healthcare is your network doesn't have the information it needs to actually allow you to make informed decisions. And so one of the things that we've done at DocDoc is we haven't tried to convince you. We think that's a failed attempt. So we don't try to say, okay, here's where you should go. What we say is that the latest and greatest research in healthcare defines quality as price, what you pay for the service, outcome, how good that physician is at the particular procedure, and experience, which is how that physician makes you feel, and how that health system makes you feel. Now, we're willing to help you understand with data how these different doctors rank for you, given your particular situation. We're not telling you where to go. We're giving you data that allows you to make the decision. And that builds a lot of trust. People don't want to be sold in healthcare. They want to be empowered. And so that's what we do, is we empower them with information. Now, but even that isn't very simple, because, so A, you have to get you have to collect the information, really hard to do. B, you then have to structure the information so meaningful comparisons can happen. That's also really hard to do. And then on top of that, you then have to sit down and explain it in a digestible format to a consumer to get them to kind of buy off on it. But what we found is that consumers are the early adopters, and that's kind of what we're seeing in digital health right now. They're massively thankful when you empower them with data. If you were to sit in our call center every single day, somebody on the phone bursts into tears. Some father of 5 in Indonesia who needs help for one of their daughters or one of their sons for some condition. And they've been trying and trying and trying to make a good decision, and they've been collecting all this information, and they just couldn't find it. And then all of a sudden, we come around, and they literally burst into tears because they're like, God, thank God this exists. And it's those levels of arbitrage that happen when you're early in an industry and you're in the right place at the right time. And the level of arbitrage you find in healthcare I've never seen it in any other industry I've ever looked at. Just the difference in quality from from physician to physician based on procedure, the difference in cost, it's really massive.
So there is a saying called the art of the start. So there's a way and when you should start a business, and the lead indicators need to be in place for you to do it, and things need to be in place. So what we did is we're about 1.5 years old, and luckily we are cash positive this month, and we should not be turning back from here on in. So why was timing so good for us to be able to raise very little capital? And I think we're probably one of the only organizations to raise a little bit of money from 500 startups, and we've never told anyone about it. The reason why we're able to do it is because the way we approached it, the first thing we did was, because this is a highly regulated environment we're in, the practitioners are regulated, the equipment's regulated, etc. There's very high emotional attachment to what we do. The first thing we did is we put our hands out and said, look, we want to be on the radar screen. So we basically engaged with the Malaysian Medical Association, and we are the exclusive partner in working with the GPs and the Medical Association to work with them to deliver the house calls, etc., which what you do. So it's similar like the financial industry as well. The organizations don't know how to regulate crowdfunding, etc. So it's the crowdfunding guys who put their hands out and says, look, I'll work with you to help regulate me. We're charting uncharted territory. Let's do it together. So that's the first thing that we've seen, and that's helped a lot as well. The second thing is, how do you get introduced to us? So we then worked with Sunway as our first hospital. So the way we work with Sunway is that every day, if you're a 500-bed hospital, about 10, 12 to 15% of your beds discharge. And we work with Sunway every time there's a discharge, and if you think the patient needs some home care support, please call us. And because they're our partner, Sunway says, why don't you call homegp, or homegp is going to call you up. And because they're our partner, we're going to let the home GP nurses come all the way to the ward, and our ward nurse will do a handover with the home GP nurse, and the home GP nurse will take you home. So that's how you break down all these barriers that we all see around two key elements in any business: adoption and usage. Sometimes you can buy a Fitbit watch, but if you don't use it effectively, you don't give someone a pathway of how to effectively use a Fitbit watch to be able to get the results that you want, you're still not going to be successful, because guess what? He's not going to buy a second Fitbit, right? So we figured out a way of how we can ensure that people adopt our brand, our name, and trust it, and use it, work with us.
That's interesting. So I guess 2 points you mentioned. So the need for a lot of data to empower the consumer to make decisions. That's really key to driving a successful business in this space. The other thing is obviously regulation and how you work around that or work with governments and regulators to ensure you're doing business in a proper way. So maybe Cole, you can start. You said you're in 8 countries. How easy was it to scale into 8 countries? Because those 2 things alone, they're big problems in itself to handle in one country and really get over that hurdle. But to have done it in 8 countries, what made you decide to go into 8 countries within 5 years of founding the business, and how has that been going so far?
So, DocDoc's a massive vision. Like we're not trying to, on the edge, adjust this little piece of healthcare, that little piece of healthcare. What we're trying to really do is provide, it's funny. Entrepreneurs often start companies because of a unique personal experience they've had. And we started DocDoc because my daughter and I had to do a live liver transplant when she was 100 days old. And the co-founder of the company is my wife. And we were very fortunate to have a true expert sitting next to us in the healthcare industry and 2 or 3 other really good doctors globally that were able to help us find the right team to do this transplant. And it was amazing how difficult that was. We didn't have a lot of time. We didn't have a lot of information. Nobody could structure that information for us. It was real tough. We were very thankful, and the transplant went amazingly well. We found literally one of the best teams in the entire world from Japan to come in and do it. They were 40% cheaper than the team in Singapore was quoting us. And the team in Singapore had done this procedure. They'd never done it on a child this young, and they'd never done it on a child that they'd done this procedure on adults maybe 3 or 4 times a year, where the team we brought in had done it over 2,000 times. And they were much cheaper. And Grace and I looked at each other and we said, we need to recreate a system that will approximate that kind of an expert to help everybody in this room and in every other room in the world figure out where they need to go when they've got something really going on in the healthcare space. Because we're all going to face this. Whether it's ourselves or people we love, we're going to be in a position where we need to find the right doctor for something that's going on. And so for us, it was less important about the local regulations and market in, say, Hong Kong or Korea or Singapore or Malaysia or Thailand. What was more important is that we got into the centers of excellence. We figured out who the right doctors were. We collected their information, and we learned how to structure it in a persuasive way to give it to consumers. And we learned how to build that trust in a systematic way. This is a big vision. I mean, it is not a small vision. When we're successful, we will change the way consumers consume healthcare forever. And the insurance companies of the world are waking up to that fact. If you think about how insane it is, insurance companies basically hand their policyholders a blank check and allow them to run around and just run into doctors based on anecdotal evidence and hope that they're taken good care of. I mean, what that does for complication rates is statistically so frightening you don't even want to know. What that does in terms of costs doesn't make any sense in medical inflation. And so it really doesn't serve the insurer or the patient. It's not in either one of their best interests. What's in both of their best interests is to empower the consumer with real data to pick doctors that are uniquely qualified for the particular condition that they face. It's cheaper, it's better for the patient, it's just better for everybody. But it's hard. It's real hard to make these kind of big, noble missions happen. I think healthcare is the right place. We're at the right time to be going after these big bites. The first guys that were bringing travel online, that was not easy. The first people that were bringing payment online, that was not easy. So the big visions that really transform the world, those guys take a lot of arrows, but they also end up, at the end of the day, really changing the world. And I think that's 90% of the reason why we're doing it.
So if I can talk about our approach to the market and growing and scaling and all these things, is that our external war cry, we champion home care. But our internal war cry, our internal purpose of why we do what we do And what are the two things that define our decision making are that, number one, we want people to own their own healthcare. We want people to own their health. And then if we can do that, then other things will come through. And the second thing is that we want to be employers or the matching organization of choice for the healthcare professionals. If we look after them, they will look after the patients. So the leading things that we look at is that in every market that as we plan to roll, we want to make sure that is there a need, a demand, and readiness for people to want to own their own health? And is there a need, a demand? And it's kind of like, you can go to every country that Spartan is going, as an example, because you just see awakening of people doing stuff and trying things. And the second part is, are people, are the healthcare providers or healthcare workers there, are they being looked after the best? What can we do to make life for them easier, right? We need to champion them as well.
You're right, nurses have got it tough.
Yeah, because the medical space, the healthcare space has big margins in most things, but that final denominator, the healthcare worker, that's where the margins come from.
Real tough, real tough. I agree. I think what you're doing is fantastic, by the way. Nurses have got it tough. These are people that do a tremendous amount of good for the world, and they're not recognized for it. I like how you empower that. And here's a perfect example. Look at what home care does. I mean, home care, it's so much cheaper for the entire system. It keeps the person at home, and the results actually lead to a change in lifestyle, which actually leads to a change in health. That's an example of a massive arbitrage that really helps consumers, right? You should be consuming more of your care at home. If your idea is that you're only consuming healthcare at a hospital, that doesn't make sense on any level. It's the most expensive, it's the least comfortable for you, it doesn't lead to long-term results. So home care is a perfect example, and look how intelligent, the way he's going in and taking a small, not even that small, a reasonably good-sized channel partner and scaling with them. It's great. What you'll find is that, and this is an important point, you're not gonna see a whole bunch of, DocDoc's been in operations for almost 5 years now, and we have done a lot of experimentation around B2C. How do we reach consumers online in healthcare? And I gotta tell you, real tough. And there's a variety of reasons why it's tough. The pricing around SEM, no matter how good you are, isn't that interesting. The SEO elements, you can drive real traffic, but the key decision makers in most of these countries really aren't online in the same way. So you consume most of your health in the first 90 days or the last 90 days of life. And most of the patriarchs are making a lot of the healthcare decisions, and they're in their 40s and 50s. So the 40s, that's kind of this group. This is why digital health is so interesting. We're online, and we're collecting a lot of our information this way, but our parents did not. So 5 to 10 years ago, the healthcare penetration in this part of the world in terms of digital was really thin. We're just getting into the fat part of that curve, and it's only becoming more interesting because of it. But I still think the groups that are very successful in digital health are going to have two things in common, in this part of the world in particular. One, they're going to have a seasoned executive team, people that have actually been in the industry for a while, and they've been building digital products. Two, they're going to have a way to acquire traffic that's not just general consumer go online like you would at e-commerce. It's a different model than that. I think those are going to be the two key elements that drive success in near term in this space.
Just touching on that a little bit. I think we'll wrap up with one last question, actually. I just realized the time's running out. So maybe just taking a big picture step back. I mean, you've been in this for 5 years. You've been in this for a couple of years. So what's your ultimate long-term vision? I think we touched on that a little bit, but maybe we'll just wrap up with, where do you see your company in like 5 to 10 years? And how do you think your company is going to really shape the industry in Southeast Asia? Because I know we were speaking a little bit about it earlier and how digital health is pretty nascent in Southeast Asia relative to a lot of the other tech verticals. So I'm really curious to see how you see the sector developing. Do you see more players coming into the space? Is there anything you think governments or other third parties could do to help accelerate the pace of change to getting to where you want it to be in 10 years?
I think the the velocity is strong. In real number terms, at our level, the way our revenue has ramped in this short period of time, there's no question that there is demand, there is willingness to discover and willingness to pay. That's nothing. The industry itself doesn't have a lot of rogue players. There's just greed. What we're dealing with is greed. So when you hear like big pharma and you hear all that moaning about them, they're not dodgy, they're greedy. Okay, but I think the empowering of the consumer is going to be there. The big, hairy, or the audacious goal is two things. One, I just want people to own their own health, the knowledge of their own health. And two, we need to champion the healthcare providers. Champion them, make life easier for them.
So I want DocDoc to be seen, and I think our team wants DocDoc to be seen as the #1 arms dealer for health insurance globally, starting in Southeast Asia on the one hand. And so what we mean by that is every major insurance company, every major employer, they're going to be saying, we want DocDoc and we want all of our consumers that consume healthcare to have access to that data to make an informed decision. We want that advocate. We want our employers or anybody who we care about, we want them to be able to call in or to go online and have a conversation with an advocate that's really going to help empower them to make intelligent healthcare decisions. That's the first thing. The second piece of this, and this is a larger piece of the vision, there's a lot of patients in the world that are cash paying. A lot of people in Vietnam, a lot of people in Indonesia, South Asia is full of people. China has a lot of individuals that just, most of the care they consume is going to be cash paying. They're not going to be insured. And we want to make sure that we also offer this form of empowerment to them because they're the ones that are in most need of figuring out where to get low-cost healthcare access. So we want to be the #1 arms dealer in terms of consumer information and empowerment for consumers to consume healthcare, both for the bottom of the pyramid and the top of the pyramid. Thank you.
Great. All right. Thanks a lot, guys.